Good morning, everyone. I'm Dr. Nidhi Goyal, consultant obstetrician and gynecologist at Goyal Hospital, Ajmer. Today, we will be discussing a very important topic, that is cervical cancer and its prevention. Now, why only cervical cancer? Cervical cancer is the leading cause of female mortality and morbidity in India. It is the second most common female cancer in India. Almost 200 patients and women die daily because of cervical cancer in India. And it is easily preventable if we take few preventive steps. Cervical cancer is caused by HPV. A large number of strains of HPV are present, most common being HPV 6, 11, 16, and 18. Other than cervical cancer, HPV may also cause vulvar cancer, vaginal cancer, oropharyngeal cancer. And in the male counterpart, it may cause anal cancer, penile cancer, oropharyngeal cancers. A large number of genital warts are also caused because of HPV. In the early stages of cervical cancer, it may not cause any sign and symptoms. It is only when the disease reaches its advanced stage the sign and symptoms of cancer cervix appear. Most common being abnormal uterine bleeding after sexual intercourse, a very foul-smelling vaginal discharge, and a chronic pelvic pain. Now, in case of cervical cancer, prevention is definitely better than cure, because if we care for the cancer, we will not have to cure the cancer. The primary prevention of cancer cervix is vaccination. Now, 3 types of vaccines are available in India right now. The very first one is Cervarix, which is active against HPV 16 and 18. The second vaccine is Gardasil, which is a quadrivalent vaccine, and it is active against HPV 6, 11, 16, and 18. Now, these 2 vaccines are imported, so they are costly for Indian population. The third vaccine which is available and is recently introduced in Indian market is by Serum Institute of India in the name of Cervarix. It is a quadrivalent vaccine active against HPV 6, 11, 16 and 18 and is very affordable and cost around 2000 rupees per shot. We have to vaccinate boys and girls between 9 to 26 years of age. But that doesn't mean if a female of more than 26 years wants a vaccination, we will not give her the vaccine. We can never deny the vaccination to the females of more than 26 years age also. In between 9 to 14 years, we have to give 2 shots of the vaccine between 0 and 6 months. And all the boys and girls between 15 to 26 years have to be given 3 shots at 0, 2 and 6 months. Now, the secondary prevention of cervical cancer is screening. The screening starts after 21 years of age. In between 21 to 29 years, we can ask the female to have a pap test, which is done every 3 years. In between 30 to 65 years, we will either go for a pap test every 3 years or we will take the patient for a co-test. What does co-test means? It means pap test and a HPV DNA test, which is done every 5 years. So that's all for cervical cancer and its prevention. Thank you.